Hi, Sean.
How are you?
How are you?
Not too bad.
Nice to see you again.
You too.
Today's your appointment for Invisalign, your first appointment. Well, you've had other appointments, of course.
Yeah.
And today's appointment was to give you your aligner 1 and 2.
Yeah.
So I think Julianne has gone over all the important things that you have to be aware. So,
Yeah.
but let's talk a little bit about when you first came here.
Okay.
I guess it's about 3 months ago,
What's
2,
that?
3 months, when
Yeah.
you first came here. And we looked at your teeth, and I think one of our biggest concern was your gums.
Yes.
So your gums had what we call hypertrophy. But can you tell me a little bit about what you think it is, or what you were told?
I'd never really known being adopted. I didn't know if it was a hereditary problem. Every time I come into the dentist's office, they always ask me if I'm on medication for
for epilepsy.
epilepsy.
Actually, matter of fact, you're right. A lot of people with epilepsy on Dilantin causes the gums to be like that.
So they've always been really, really swollen, to the point where you could almost not see my teeth at all. Could almost not see the molars in the back, and it's always just become an issue as far as smiling, taking photos. I don't smile. Just don't do it.
Yeah, yeah, I can understand that because, well, as you can see in this photo, only about, I think, I would guess about 40% of your teeth was covered by excess gum tissue. So as you can see in this other picture, we have did some gum surgery on you. Yeah. And tell me about the experience with the different specialists that you had for this type of gum problem that you had.
Well, I've been recommended to different specialists before, and they had told me that it was going to be in the area between $6,000 and $10,000, and that was to do with the 4 quarters of my mouth. Couldn't really afford that.
$6,000 to $10,000.
Just for the gum work.
Yeah.
And that had nothing to do with the Invisalign or everything after, so I would have been looking at about $16,000 to $20,000 mouth adjustment.
Yeah.
You could provide me a better price.
Yes, right. Yeah. Unfortunately, I have a bit of experience in the type of problem you have, not to the point of the amount of excess tissue you have, but I do a lot of electrosurgery that trims excess tissue, and I said, you know what, let's give it a try, and as it appears, it's worked.
Yep.
And you can see that and it's maintaining. I was worried that for what I was going to do to you, as opposed to a specialist, mine might not work as well. It might roll back, but thank God it didn't roll back.
Yeah, no.
And now we're in the same direction. We're going in the proper direction, doing your Invisalign, getting your teeth aligned. Okay, so I think, so after we did that, I had to do a bonding, right? So
Yes.
one of your teeth, and it stayed.
Yes,
Good.
it had to
Because
stay.
one of the teeth was shorter than the other.
Yeah.
So another thing that I realized when I was looking at cases, or you probably aware that you have a lot of severe attrition,
Yes.
a lot of grinding habit.
Yes.
And I think a good 25% of your teeth have been grinded away just from habits,
Yeah.
from habits that a lot of people have. And so we're going to try to deal with that as well.
Okay.
But first, we have to get the teeth aligned, and the best way is with Invisalign. Invisalign has an advantage because it grabs your whole tooth and moves it.
Okay.
And in your case, your teeth are already compromised with the grinding that you had. So sometimes it's very hard to put braces on the teeth that are really short. So, and that's why I think Invisalign is a very appropriate treatment. Okay. Now, on top of the Invisalign, we're trying something also fairly new, and that's the Accelident,
Yes.
which we'll go over later on. Accelident is an appliance that claimed to reduce your treatment time by 50%. So we're going to see. But for those that are not completely aware of how Invisalign works, Invisalign is an orthodontic procedure where you change your liners every 2 weeks. And today, as we said, you're given a liner 1 and 2.
Yep.
So every 2 weeks, today we give you 2. So you're going to have the second one, and the second one you change on you in 2 weeks. Okay. And it's based on wearing them 24 hours a day, less you're eating, and you can drink with them, tea, coffee, even wine. Don't worry about that. It won't. In 2 weeks, it won't stain to a point where it's noticeable.
Okay.
Because that's the whole idea about Invisalign, is that we don't want it to be obvious to people that you're wearing anything. So change them every 2 weeks, and then we're gonna see you in 4 weeks, And that's where we're going to give you 3 aligners after that, 3 aligners at a time. Your next one, you're going to have some attachments put on your teeth, like little additional squares and resin attachments. They'll be the same color as your tooth material. That helps to grip certain teeth better. It increases the surface area of the teeth so that the Invisalign will grab on and help to shift and rotate your teeth. So that's a line of one you have in your mouth right now. It's hard to see from that distance, but certainly, you know, I guess most people are familiar with Invisalign, how it works. And I think that's it. Do you have any questions? I think Julianne went.
The only thing I wanted to know was, am I able to use the Accelerant while I have the Invisalign in, or should I take the Invisalign out?
No, the idea of the Accelerant, which I'll give you more instructions later on, is I think I just gave it to you about last week. So, is that what it does is that you apply the Accelerant while you're wearing Invisalign. It helps to shift your teeth quicker, and it helps to stabilize the movement of your teeth in that new position. Because the idea of changing them every 2 weeks instead of changing them every couple of days is that during the 2 weeks your teeth will move to a new position and stabilize in that position. And then after you change the aligner into another aligner, it move it again. That's how Invisalign works. Well, Accelerant is going to help for the gums to stabilize, for the bone structures to stabilize better and faster. And that's why rather than wearing them every 14 days, each aligner, we could reduce it to 7 to 10 days. We won't at this point yet because we're just beginning. We want you to get used to it, but at one time we're going to analyze your movement of your teeth to see which one we could where we could cut down the time, because right now your treatment is going to be 53 aligners. Okay, with 53 it means that you wear 2 every month, so you divide that by 52, which turns out to be 26 months, which is a couple of years. So with the Accelerant, we're hoping to reduce the 26 months to less. No, I don't think 13 months, but more like
Excellent.
quite a bit better. Anyways. But we'll see you in a month. And when you come back at that time, we're going to take a look at your animation of your movement, and we're going to make sure that your teeth are moving according to what the prescription movement is on Invisalign. So every time you come in, we're going to give you 3 at a time. Every time you come in, we look at where your teeth are, the position of your teeth, and we're going to compare it with what Invisalign shows us it's supposed to be. And then we'll know whether we're on track or we're kind of something's not going right. But that's the beauty about Invisalign, is that we really know exactly where your teeth are supposed to be at any given time. Whereas you cannot do that with Invisalign. You can't do that with any type of treatment, whether it's dental, surgical, anything. You cannot predict how things are going. With Invisalign, there is some accuracy with their proposed treatment. Not some accuracy, they're quite accurate. But like all things, there'll be some flaws here and there, and and as we go, we're going to determine what they are and make sure. Oh, just last thing, these things are given to you. You're given proper instruction. These are my specialized golf tees, not to play golf in. Well, you could play golf with it, but once you start using it in your mouth, I don't think you want to. Or once you start playing golf, you want to stick this in your mouth. It's something that you use to chew on to make sure that the aligner sits properly. It's made of wood, so it's a soft material, and this is something more condensed, hard rubber. We sometimes recommend patients to chew on these while they're driving, or when they have some special time where they can just sit and do nothing. They can just chew on them while they're watching TV. So that helps to seat the aligner in its proper position.
I'm finding too with the liner so far. I mean, I've only had it on for an hour, but I'm finding that it doesn't really affect my speaking.
Yeah, that's great. Yeah. Well, I'm wearing mine too.
Oh, you have them too?
I have them too. Yeah, I'm wearing mine too. Very good. Once you get to the point where you're wearing them, and you take it off to eat or whatever, you really feel so comfortable. You more or less finish eating, go back and put it back on. So it's not hard to follow this prescribed treatment, because it's like anything. Once you get comfortable with it, it's hard to forget about it, because it's on your mind all the time.
And how far along in your treatment are you?
I'm halfway.
Right?
Yeah,
Good for you.
I have about 53 as well.
Is that right? Eh?
I'm moving my midline over, so it's. But I'm glad I'm doing it because I certainly can relate with my patients a lot better than before I started. Sometimes I question why they do certain things, but now doing this by myself really allows me to relate with certain downfalls, certain deficiencies that patients might run into.
Yeah.
So,
Excellent.
all right. Well, thanks for viewing this video, and thank you, Sean,
No
for
problem.
letting us
Appreciate it.
film this. And we will maybe continue to update
Excellent.
some YouTube videos as we go.
Perfect.
All right.
Thank you.
Okay, bye now.
Bye-bye.